patient gets referred to the clinic, it could be a number of different ways. So it could be from the eye clinic, where they've been seen in a specialist eye clinic and they have been found or suspected to have thyroid eye disease. It can be a referral from an endocrine clinic, either locally in the hospital itself, because this is a specialist more of a dedicated specialist service to the eye. So it could be from they have Graves' disease, they have thyroid disease, and are seen in a general endocrine clinic in our hospital, and then felt that they need specialist input from the clinic. It can also be from a general endocrine clinic in any of the peripheral hospitals, because this is the sort of like tertiary service for thyroid eye disease. And we operate this clinic 3 times a month. So because we would like patients to be seen as soon as possible. And it can be a very busy clinic, because as we get referrals, we tend to accommodate the referrals as soon as possible, because there's obviously the impact of it's a sight-threatening disease. So when the patients get referred to the clinic first time round, there are 3 different stations that they go through. So not usually in that particular order, but first of all, they would be seeing the optometrist, whereby they will have all the technical assessments of the eyes carried out. And following that, they will proceed to the ophthalmologist station, whereby they will have the history taken, symptoms in particular, which would be causing problems. And then, and usually with the optometrist, they have their visual acuity done, color vision, all necessary measurements, the pressure of the eyes and everything. And then they move on to the ophthalmologist, and then the ophthalmologist then works, discusses the patients with us. And then we, as the endocrinologist, we are very we look more at the thyroid function side of things, and we coordinate their treatment for the thyroid, for their thyroid disease. So it's usually the medication, their blood tests, coordinating with the thyroid endocrine surgeons as to sort of eventual treatment. And usually it's after they've seen all these 3 different specialties that the plan is formulated, and then a plan for follow-up. If you're coming for the first time, first of all, you will have your vital signs measured. You will see the nurse who would be checking your vital signs and checking your blood, your weight and your height. And you can bring whatever information you would like to, especially sometimes some patients have had these symptoms for a while, and they are very troublesome. So if it's easier for them to write down the symptoms and bring them to clinic so that they don't forget, that's absolutely fine. We do have an in-house nurse who does the blood test as well, so that they can have the blood test done after the clinic appointment. So that then it's all done together. We review the results after they get the result, or after they are back, and then we can just let them know the following week what to do with their medications. In terms of, they're welcome to bring a family member, a relative, a friend with them, but they don't necessarily have to. And with regards to communication, so the plan, they get a letter. Well, we send a letter to the GP, we send a letter to them as well for their own record regarding the plan. And usually, depending on the severity of the eye disease, sometimes if they have got severe eye disease, they could then proceed during the same appointment to having intravenous treatment, intravenous steroid treatment, if that is required on the same day as well. But that's not the usual treatment. That's usually if it's very severe. Don't be scared to ask any questions whatsoever. We are here to help you, and it can be very daunting at times when you come to a clinic where there's so many different stations, And but just don't hesitate to ask anything. We're here to help, and we are always ready to help. There's no stupid question. There's no silly questions. When patients have been discharged from the clinic, they are like a recurrence of symptoms, they could either go back to their GP if they've been completely discharged from the hospital. If the GP is concerned, then there's an email advice and guidance sort of platform where the GP can just email us, and then that would get sort of like filtered down to us to accommodate the patients in clinic.